we're communal beings, meaning that generally we like being around other people. We want to connect with people. And when you're forced to really stay in isolation, that becomes very dangerous, especially if they don't have a trusted person that they can communicate with on a regular basis. So staying connected is extremely important. We're in an atmosphere right now that's both politically stressful, economically stressful, and we're now seeing the impact of how that's related to an increase in alcohol use, an increase in overdoses, because that type of so-called community toxic stress impacts everybody. When you wake up in the morning and you hear that there's a shooting down the street, or somebody overdosed, or somebody died from COVID, all of those things really cumulatively impact the entire community, unless you're just totally removed from the circumstances. But if you're involved, all of that becomes cumulative stress. But mental health needs and substance abuse treatment needs are very closely related. If a person is depressed and they're, let's say, drinking alcohol to soothe their depression, then they're very likely not going to take their blood pressure medicine or their diabetes medicine. So we know that for instance, with opioid addiction, that 50% of the patients suffer from either anxiety or depression, and 90% have a diagnosable mental health problem. So there's a very close association. So if you have both a mental health and substance abuse problem, the cost of treating any chronic disease, whether it's high blood pressure, diabetes, congestive heart failure, the cost goes up 4 times if you have both.